I'm going to be doing a head-to-toe assessment on this newborn baby boy who was delivered vaginally. The vital signs were already taken previously. Just on initial assessment, there's no abnormal, gross abnormalities on the baby. Skin is soft and pink throughout, so nothing abnormal on first glance. I'm going to start by listening to the heart for a full minute and the apical pulse. Okay, a minute has passed. The heart rate was within normal limits at 120 beats per minute. No murmurs were present, nothing abnormal there. I'm now going to listen to the lungs, observing. The breath movements look symmetrical, doesn't look like there's any retractions. So I'm going to now listen to the lungs. Listen to breath sounds for a full minute, and those are within normal limits at about 40 breaths per minute. There was no crackles or bronchi present. I'm now going to auscultate for bowel sounds. There was also no nasal flaring or gasping or any signs and symptoms of respiratory distress. Bowel sounds were active in all 4 quadrants. I'm now going to assess the skin. Like I said, the skin is soft. It's generally pink throughout. There's a little bit of dry skin, but that's within normal limits. There's some vernix throughout the skin, but that should subside within 24 hours. No abnormal birthmarks, pigmentations, or Mongolian spots, anything like that. There is some milia on the nose, little white spots, but those will subside. I'm now going to assess the turgor. And the skin came back right away, so that's within normal limits. There does not seem to be any jaundice. I'm going to open the eyelids and look in the sclera. And there's no yellowness in the sclera. The scleras are white, so no jaundice is noted. Now I'm going to check the measurements of the baby. So I'm going to measure the length from the top of the head down to the heel of the foot. And the length of the baby was 20 inches, so that's within normal limits. I'm now going to measure the head circumference right above the eyebrows, all the way around the head. And that was about 35 centimeters, so that's within normal limits. I'm now going to measure the chest circumference at the nipple line. And that was 33 centimeters, so that was also within normal limits. Looking at the head, the shape of the head is round. It is normocephalic. There's no caput, no cephalohematoma present. I'm now going to palpate for both fontanelles. Okay, posterior and anterior fontanelles are present. They are soft and firm. The facial symmetry is present. Everything seems to be symmetrical. I'm going to draw a line from the eyes to the top of the ear to show that everything is in line with the eyes and the top of the ear. The baby has their eyes wide open, so everything looks normal there, and there was no jaundice present in the eyes. I'm now going to kind of squeeze the ears and check for cartilage, and the ears flip back right away, so looks like there's good cartilage in the ears. I'm now going to clap and see if the baby reacts and is able to hear that clap. Okay, the baby was startled, so shows that he was able to hear that clap. Looking at the nose, like I said, there's some milia on the nose, but that's within normal limits and that should subside. The nose looks symmetrical. I'm going to assess for patency of both nostrils. So I'm going to cover the first nostril, and the baby is able to breathe from the other nostril. I'm going to do the same thing on the other side, and the baby was also able to breathe on that nostril. I would probably wash my hands at this point. Now I'm going to be looking at the mouth. I'm going to check for the rooting reflex first. Okay, so the baby turned its head to the side, so the rooting reflex is present. I'm now going to check the sucking reflex. My finger in their mouth there. And that reflex was present. I'm going to palpate along the gum line, palpate the soft and hard palates, and those are intact. The tongue is moving freely, and the uvula seems to be midline and is moving symmetrically. Now assessing the neck, I'm going to pull back the skin folds. Everything looks like within normal limits on the skin of the neck. I'm going to palpate around the neck, and I don't feel any masses or lymph nodes or anything like that. I'm going to assess the clavicle and palpate there, and I don't see any crepitations or anything like that, so no signs of fractures that could have occurred during birth as the baby was leaving the birth canal. Don't feel anything like that. I'm going to check the range of motion on the neck, so I'm going to turn the baby's head from side to side, and it looks like there's full range of motion there in the neck. I'm now going to assess the nipples. So it looks like there are 2 nipples, no extra nipples. The areolas are full, and I'm now going to measure the size of the nipples. So looking at the first one was 7 millimeters, so that's within normal limits. And the second one was also 7 millimeters, also within normal limits. Moving down to the abdomen, I already auscultated. I'm going to first lightly palpate. Okay, and there were no masses noted upon that first palpation. I'm now going to palpate deeper. Felt that liver in the right upper quadrant. Everything was within normal limits there. Looking at the umbilical cord, it looks like there is 1 vein and 2 arteries, so that's within normal limits. I'm now going to take the femoral pulses and the brachial pulses and compare those. Okay, those were 120. Now I'm going to assess the brachial pulses. And those were 120 as well, so since those were equal, that's also within normal limits. I'm now going to assess the genitals of this baby. So looking at the urinary meatus, that is in the right location, so that's within normal limits. The scrotum is dark pink. I'm now going to palpate for both testes. So since I was able to palpate both of those both have descended, so that's within normal limits. The baby voided during delivery, so that's within normal limits. I'm going to assess the anus. I can see the anus visibly. The baby also stooled already, so the anus is patent, and that is all within normal limits. The baby also has not been circumcised yet. Now looking at the hips, I'm going to assess for any hip dysplasia. The knees seem to line up, so the hips look symmetrical, no discrepancies there. And no cracks, so does not seem to be any hip displacement there. I'm now going to turn the baby over to its back and inspect the back side. Just looking at the neck and the back of the head, I don't see any signs of birth trauma from that end, so that all looks like that is within normal limits. I'm gonna now palpate the spine for all the vertebrae. And that is also within normal limits. Looking at the baby's buttocks, there is no sacral dimple. I'm now going to listen to the lungs from the back side. Breaths are within normal limits, about 30 breaths per minute, again on the back side, unlabored, so that seems to be within normal limits. Flip the baby back over. I'm now going to do the stepping reflex, see if the baby steps up as I kind of press their feet down, and he did. The baby has been moving around, so I think the muscle tone is within normal limits. The baby has been able to kind of move freely around throughout this assessment. I'm now going to bend the arms back and forth and check for range of motion in the arms. That is present. Seems to be present in the wrists as well. And the fingers, fingernails look within normal limits. I'm going to check for capillary refill in each of those. And that seems to be brisk, less than 3 seconds. And active range of motions in all fingers. I'm now going to check for the palmar grasp reflex on both sides, and the baby was able to wrap its fingers around both of my fingers, so that reflex is there. I'm going to check for any abnormal creases in the palm, especially horizontally, which could be an indication of Down syndrome, and that is not present in either hands. I am now going to look at the lower extremities, so I'll kind of move the legs around and check for range of motion there. Already checked the hips. Range of motion is active in the legs. I'm going to check the ankles. Range of motion is active. Looking again at the toenails. Those seem to be within normal limits. I'm going to check the capillary refill on the toes. And it is brisk, less than 3 seconds in each toenail. So that is within normal limits. I'm going to check the plantar grasp. Okay. The toes wrapped around my finger, so that reflex is present. I'm going to check the other foot. And he wrapped his toes around my finger on that foot. I'm now going to check the Babinski reflex, going from the outside of the heel up to the foot, and that is present. Same thing on the other foot, outside of the heel up to the toes, and that is present as well. I'm going to check the startle reflex of the baby, so I'm gonna pull his arms in and let go, and he was startled, so that reflex is present as well.